Thanks to the organizers for allowing me this opportunity to address you on COVID-19 pandemic in Africa and its impact on children. Over the course of the next 15 minutes, I'm going to briefly describe to you the epidemiology of COVID-19 on the African continent, and in particular, the impact that COVID-19 has had both directly as well as indirectly on child health on the African continent and what we can anticipate in the years to come. So globally, to date, as of the 23rd of June, there were roughly about 179 million cases of COVID-19 that had been identified. Of those 179 million, less than 3% of those cases have been documented on the African continent. Despite the African population constituting closely to 17% of the global population. More interestingly, is that of the cases that have been documented on the African continent, roughly 35% of those cases have been documented in a single country, which is South Africa, which constitutes 4.4% of the African population, compared with Nigeria, one of the most populous countries on the continent, which constitutes 15% of the population. Yet only 3% of all of the COVID-19 cases documented on the continent have occurred in Nigeria. In addition to which, a very similar sort of picture emerges when looking at deaths that has occurred from COVID-19. Globally, there's roughly 3.9 million cases that have occurred to date, of which approximately 139,000 cases have occurred on the African continent, constituting less than 4% of all of the COVID-19 deaths that have been documented globally. Further detail on this in Africa shows that South Africa, again, which constitutes less than 5% of the African population, has accounted for close to over 40% of all of the deaths that have occurred, whereas countries such as Nigeria, that constitutes 15% of the African population, account for only 1.5% of all of the COVID-19 deaths that have been documented in Africa. Now, one of the major reasons for this is most likely because of systematic undertesting when it comes to trying to investigate for COVID-19 and infection by the SARS-CoV-2 virus. As an example, using the United States as a reference, the cumulative testing rate for SARS-CoV-2 infections in the United States is in the region of about 1,400 tests per thousand of the population. On the African continent, the country with the highest testing rate tests at least about 6-fold less than what is being done in the United States, and that is South Africa, where testing rate has been roughly about 200 per thousand of the population, and in Nigeria is close on to 20 times less than what it is in South Africa. Now, in addition to that, even when specifically looking at South Africa, despite it having the highest number of cases of death that's been documented, that itself might be an underrepresentation when it comes to the number of people that have died. These data, which look at excess mortality, those are deaths that occur over and above what would have been expected based on historical trends, indicate that as of the 19th of June 2021, there were roughly 173,000 excess deaths in South Africa, as opposed to the 58,500 documented cases of COVID-19 that had occurred. The synchrony of the waves of this excess death and what you actually observe when it comes to COVID-19 deaths, as shown on the right-hand side, clearly demonstrates that the majority of this excess mortality is most likely directly because of COVID-19. In South Africa, what we also observe is that at a provincial level, looking at different provinces, some of the more better resourced provinces, such as the Western Cape, there's a much stronger correlation as to the number of documented deaths and excess mortality recorded deaths compared to other provinces. So unfortunately for much of Africa, this sort of data, looking at using vital registration systems, are not available in real time to truly quantify in the immediate future as to what the excess mortality has been, which would largely be attributed to COVID-19. Now, one of the other important features is that does this mean that the infection with the virus is uncommon on the African continent? And the short answer to that is extremely unlikely. So these are data from Gauteng province in South Africa, where about 25% of South Africa's population live. It's one of the smallest in landmass, but the most densely populated. And this was a survey which was completed around about the middle of January 2021, before a second wave peaked in this particular province. Overall, across the province, what we observed was a seropositivity rate of 19%. When looking at it by different age groups, we observed that despite repeat lockdowns that occurred during the course of 2020 in response to the COVID-19 pandemic, as well as closure of schools, those sort of interventions had very little impact in protecting children from being infected with the virus. In fact, across all age groups, including children under the age of 5 and 5 to 18, the seropositivity rate in this age group was similar as documented in the older age groups. So infection with the virus has been ubiquitous across all age groups in a country such as South Africa. And it would be very surprising if this weren't the case in any of the other African countries. So despite the high force of infection that's taken place both in adults and children, the epidemiology of COVID-19 is starkly different in relation to in children relative to what has been observed in the adult population. As these data show you, the cumulative, and this data from South Africa, once again, where the majority of both public as well as private hospitals are contributing to data which is managed by the National Institute for Communicable Diseases. What the data basically illustrates to us is that the incidence of hospitalization for COVID-19 in children under the age of 19 is 13-fold lower than compared with what is observed in adults above the age of 19. So children in South Africa make up roughly about 1/3 of the population, yet only about 4% of all of the hospitalizations that have occurred in children have occurred in those in the childhood age group. Of those children that have been admitted, roughly about 20% or 1/5 of them have got other underlying medical conditions that might have increased the susceptibility to being admitted. Amongst the children themselves, as you can observe on the right-hand side, the incidence of COVID-19 hospitalization is greatest in those under 1 year of age, and then goes down and then increases again slightly in those that are in the 15 to 19 year age group. So the highest incidence or highest burden of COVID-19 when it comes to hospitalization in children is being observed in those under 1 year of age. Now, the underlying medical conditions that have been associated with hospitalization in these children, most common is underlying asthma. And this might well be, as for any other respiratory virus, where infection with SARS-CoV-2 precipitates an acute illness in the children with asthma, resulting in hospitalization. Other underlying conditions that have been associated with hospitalization due to COVID-19 includes diabetes as well as HIV, and particularly in the older age groups. Both diabetes as well as HIV in a South African context with a very robust mother-to-child transmission program, particular HIV is relatively uncommon, probably constituting the prevalence in children being probably less than 1%, yet a fair percentage of those children that are ending up in hospital or being hospitalized have got underlying HIV. So when it comes to mortality from COVID-19, the global experience has been one where even in high-income countries, it's really a minority of deaths from COVID-19 that have occurred in children under the age of 19. In the United States, only 0.06% of cases have occurred as of July 2020, and there might be more updated data on this. In countries such as Italy, during the course of the first wave, none of the deaths, none of the 30,000 deaths that did materialize in Italy were in children. And similarly, in India, it's only about 0.29% of deaths that occurred in children under the age of 18. In addition to mortality, another point of interest in the pediatric community is COVID-19 resulting in multi-system inflammatory illness. Although this is, again, a relatively uncommon condition in illness, the mortality risk from this illness is also extremely, extremely low, sitting at about 0.7%. Now, one of the challenges that we face with SARS-CoV-2 is that we do understand that the majority of children that are infected with this virus would be asymptomatic. And the question arises as to whether, when documenting the presence of the virus in a child that has demise, whether that infection is actually, whether the child is actually dying with the virus or because of the virus. And the only way to be able to delineate that is to probably do postmortems. Now, in South Africa, the experience in terms of COVID-19 mortality in children is that, again, it's extremely uncommon, as I mentioned. In fact, compared to what we observed in adults, it almost doesn't even appear on the graph in relation to deaths that occurred per 100,000 of the population. So to date in South Africa, there's roughly about just 400 children that have been documented to have died of COVID-19. with a case fatality risk of about 4.2%. About 1/3 of the deaths that have occurred in South Africa are, again, deaths that have from COVID-19 or where the virus has been identified, are deaths that have occurred in children under 1 year of age, and about 1/3 in a 15 to 19 year age group. Of those children that are hospitalized, the highest case fatality rate or risk is in those that are under 1 year of age, that is infants. 60% of children that have died of COVID-19 in South Africa have been documented to have some sort of an underlying medical condition that likely predisposed them to developing COVID-19 in severe disease. Now, as I mentioned, the most robust manner in which to determine whether the presence of the virus actually is associated with an illness is to do postmortems. In this particular study that we did at one of the largest hospitals in the Southern Hemisphere in South Africa, all children that died during the course of the first wave were systematically sampled for the presence of the virus. And what we identified in the 171 children that did die, 72% of whom were neonates, is that the virus was identified in 21 cases, roughly about 12% of all of the deaths. We were able to undertake minimal invasive tissue sampling in 12 of those cases. And of those 12 cases, we were able to determine that the presence of the virus was in fact associated with most likely the COVID itself. So COVID-19 was attributed to be in a causal pathway of close to 92% of those samples of those children that were sampled using minimal invasive tissue sampling. And the type of pathology that was observed in these children was very similar to what we had actually observed, to what has been described in the adult population, in that we're looking at diffuse alveolar damage, including intraluminal fibrin and platelet thrombosis, as well as what seems to be somewhat unique to COVID-19 disease, and that is bizarre type 2 pneumocyte hyperplasia. In addition to which, we also saw pathology in the lung, including myocarditis, as well as necrosis in the liver. In this particular analysis, what we also demonstrated is that over half of the children that died of COVID-19, those deaths were associated with culture-confirmed invasive bacterial disease, and often that was a consequence of hospital-acquired infections. Another important issue in the pediatric space is what impact infection during pregnancy might have on the outcome of the fetus. And in this analysis in South Africa, where we looked at women that had confirmed COVID-19 illness during pregnancy, that is before they delivered, and compared the birth outcomes compared to those individuals that had taken a control set that had tested negative and were asymptomatic for any respiratory illness. What we demonstrate is that babies that were born to mothers that had COVID antenatally had a 1.67-fold greater odds of having low birth weight, that is birth weight of less than 2,500, and a 3.25 higher odds of having a birth weight of less than 1,500 grams. So similar to what has been described elsewhere, COVID-19 during pregnancy in South African women was associated with a higher risk of low birth weight as well as preterm labor. Now, I would like to conclude just for a few slides in terms of what can we expect moving forward. Almost a year ago, modeling was undertaken to determine what the impact of COVID-19 measures and the impact it might have when it comes to provision of health services, as well as utilization of health services, what that could do when it comes to increasing childhood mortality, especially in low and middle income countries. What was observed in this particular model in terms of estimates is compared to the baseline of roughly about 430,000 deaths that occur each year. If there was even just nominal interruption in terms of healthcare services, both to pregnant women as well as children, we could anticipate about an 8% increase on a month-to-month basis of excess mortality indirectly occurring because of the measures that have been implemented around COVID-19 that was impacting on other healthcare service deliveries. And in a worst-case scenario, each month there might be up to 190,000 additional children dying, not because of COVID, but rather because of the consequence of not actually gaining access or to other healthcare interventions. In this particular analysis, the factors that were most likely to indirectly contribute to excess mortality occurring in children was issues around nutritional services being compromised, which could possibly result in up to 18 to 23% additional childhood deaths because of an increase in prevalence of wasting, and then about 40% in additional deaths that might occur because of reduced coverage with antibiotics for pneumonia treatment, for treatment of neonatal sepsis, as well as oral rehydration therapy for diarrhea. So what we have observed globally is that in more than 94% of countries, there's been some sort of disruption of healthcare services at one level or another. In about 1/3 of those countries, the disruption that's occurred has been of a really high magnitude, with more than 50% of healthcare services being disrupted. When looking at a type of healthcare services that have been disrupted, particularly in the maternal, newborn, and child and nutritional services space, globally, about 40% of countries that have reported into the survey have reported disruption to healthcare services, including roughly just over 40% of countries on the African continent. And these include disruption of services when it comes to the care of the sick child, and those are the type of no access to antibiotics, as an example, for the treatment of pneumonia, neonatal sepsis, as well as issues when it comes to management of malnutrition, where there's disruptions in roughly about, again, 40% of the countries. In addition to which, what we also observe across the globe, both in high-income as well as low- and middle-income countries, is disruptions in relation to immunization services. On the African continent, more than 40% of countries, almost 50% of countries have reported disruption when it comes to immunization services. Unfortunately, those sort of disruptions are deaths that are yet to materialize in the years to come. So in conclusion, there's been likely a systematic underestimation of COVID-19 cases on the African continent, including in South Africa, where the testing rate for SARS-CoV-2 infection is modest compared to that in high-income countries. SARS-CoV-2 infection in children in South Africa, as an example, has been very similar to in adults, but nevertheless, what we see is markedly differences when it comes to hospitalization rates as well as death directly associated with COVID-19. Being significantly lower in children than in adults. Last but not least, again, to emphasize that the disruption of maternal, newborn, and child health services as a consequence of our response to COVID-19 is likely to indirectly result in increased childhood mortality, anything between 8 to 45%, particularly in low and middle income countries. So I thank you for your attention.